Hello, everyone. Next, let's learn about hospice care. On March 12th this year, after Aunt Chiang Yao reading an article titled, "Reserve a Beautiful Farewell for Myself," she publicly released a letter to her son and daughter-in-law. In the letter, she made 5 statements regarding her end-of-life situation. First, no matter what serious illness I may suffer from, don't perform major surgery. Second, don't send me to the intensive care unit, ICU. Third, no matter what the situation is, absolutely not to insert a nasogastric tube. Fourth, absolutely not to insert any life-sustaining tubes on me. Fifth, regarding the final emergency rescue measures, tracheotomy and electric incision, all of these shall be refused. Helping me pass away without pain is more meaningful than going to all lengths to keep me alive in agony. Do you agree with Aunt Chiang Yao's viewpoint? If one day we grow old ourselves, would you want to give up rescue efforts and die a natural death? If one day, when facing a loved one with no hope of recovery, what choice will you make? With these questions in mind, let's start today's lesson. Let's first take a look at what end of life means. End of life refers to a state where, due to the final stage of a disease or an accident, the physiological functions of the body's major organs fail. Despite active treatment, there is still no hope of survival. Various signs indicate that life activities are about to come to an end. For a person in the end-of-life state, death will inevitably occur. It is the final stage of life. Currently, most countries and regions predict that a patient has a survival time of less than 6 months is defined as the terminal stage. So, what is hospice care? Hospice care, also known as palliative care or end-of-life care, refers to a team composed of professionals from all levels of society, which provided for terminally ill patients and their families with comprehensive support and care in physical, psychological, and social aspects. This concept tells us who provides what kind of service. Let's first address to whom the service is provided. Hospice care offers support not only to terminally ill patients but also to their families. Those who have had similar experiences will understand that for a considerable period after the patient's death, the patient's families have some difficult emotions to deal with. The patient's families are both the service recipients of hospice care and the main caregivers and supporters for the terminally ill patients. So, what kind of care should we provide? Our care is not limited to their physical aspect or bodily conditions. Instead, while meeting their physical needs, we also offer support in psychological and social aspects. What kind of care should we provide? Obviously, it is impossible to accomplish this task by oneself. He needs a team. Let's think about it. Which people do we need in this team? Doctors, nurses, dietitians, psychological counselors, social workers, volunteers, and government representatives. Next, let's learn about the service philosophy of hospice care. The first philosophy is care as the core. Hospice care targets patients whose lives are drawing to a close, and for whom medical treatment is no longer effective. For these patients, the goal is not to cure their illness to avoid death, but to provide comprehensive physical and mental care, along with appropriate palliative treatment in their final stage of life. This includes controlling symptoms, alleviating pain, relieving anxiety and fear, and providing psychosocial support, all to help patients achieve peace in their final moments. The second philosophy is upholding the dignity and rights of terminally ill patients. The life of a terminally ill elderly person compared to an ordinary person is not inherently different. They should enjoy the same basic rights as ordinary people. UC is the right to be informed about their illness, the right to choose their treatment plan, the right to sign an advance directive, and the right to receive death education. The dignity and rights of life must be safeguarded. The third philosophy is improving the quality of life for terminally ill patients. Life has not only quantity but also quality. The quality of life matters more. Improving the quality of life for terminally ill elderly individuals is the fundamental purpose of hospice care services. This means neither accelerating nor delaying the dying process. For terminally ill patients, we shall not only help them stay comfortable and meet their physical needs, but also focus on providing psychological support, allowing their family members to stay by their side, and offer emotional comfort, understanding the patient's psychological needs, and doing our best to fulfill their wishes. UC is checking if there are people or things they still want to see, or unfinished matters they wish to address. The fourth philosophy is death education. Accept death. Death is a highly taboo topic. We often unconsciously choose to avoid or set it aside. However, death will never cease to exist just because we avoid it. Everyone will face death. It is an inevitable natural process of life. Accepting death is not a denial of life. It allows life to complete its specific final journey. The fifth philosophy is providing comprehensive holistic care. I believe this point has been made very clear in the concept of hospice care. Care includes comprehensive support in physical, psychological, and social aspects. It covers not only the patients themselves but also their families. We provide care for the entire family, help family members acknowledge death, participate in the elderly patient's end-of-life care, offer appropriate psychological support to the family after the patient's passing, and helping them cope with the grief of losing a loved one. In China, 70% to 80% of annual medical expenditures are spent on artificial life support systems for terminally ill patients. For many people, 90% of their total medical expenses throughout their lifetime are concentrated in their final terminal stage. If birth, aging, illness, and death are inherently an irreversible process of life, why can't we let this process unfold in a more peaceful and beautiful way? After learning today's content, I believe you have gained a deeper understanding of Aunt Qiangyou's statement. Today's class is over. Thank you all.